Think a sore throat or bloated stomach is no big deal. New scientific research says it might be waking up hidden cancer cells. Most people write off inflammation as just part of life, a cold, a sports injury, or that lingering heartburn after pizza. But here's the shock. Harvard Medical School confirms 15 to 20% of all cancers start with chronic inflammation. This isn't the acute fever that fades in days, it's smoldering inflammation, silent, persistent, and dangerous. Things like gum disease you put off treating, acid reflux you manage with antacids, or fatigue you blame on work stress could all be its disguise. When the body stays in repair mode for too long, cells divide non-stop to fix damage. Each division is like rolling the dice. It can cause DNA mutations, and those mutations are how cancer starts. Think of it like a factory working overtime, more mistakes, more defective products. In September 2025, scientists from the Chinese Academy of Sciences and the Massachusetts Institute of Technology dropped a major study in PNAS. They filmed inflammation waking up dormant cancer cells in real time. Here's how the study worked. First, they forced breast cancer cells to sleep in mouse lungs, harmless, inactive, like seeds waiting for rain. Then they triggered mild chronic inflammation for weeks later. The sleeping cells woke up, and the number of lung tumors increased by 2.7 times. What's the culprit? A molecule called EGFR ligand. Think of it as an alarm clock. Inflammation puts the immune system to sleep and rings that alarm clock at the same time. Worst of all, once these cells wake up, they never go back to sleep. Even after the inflammation faded, the cancer kept growing for months. This isn't just lab theory. The Lancet Oncology tracked millions of patients and found chronic gastritis, stomach inflammation increases stomach cancer risk by 6 times. Hepatitis B, liver inflammation spikes liver cancer risk by 20 times. Ulcerative colitis makes colon cancer 15% likely within 10 years. Dr. Rudolf Virchow, the father of pathology, first linked inflammation and cancer back in the 1800s. He said, "Inflammation is the match that lights the cancer fire." You might not realize it, but your grocery list could be one of your biggest risk factors. A 2025 study in the Journal of Nutrition analyzed 930,000 people and found people who ate the most pro-inflammatory diets had a 61% higher risk of colon cancer. Men were even more vulnerable. Their risk jumped by 67%. What's a pro-inflammatory diet? Things like red meat, processed snacks, fried food, and sugary drinks. These foods raise 6 key inflammation markers in your blood, including C-reactive protein CRP and interleukin-6 IL-6. But here's the good news. You can fight back with your diet. Anti-inflammatory foods, leafy greens, fatty fish, whole grains, vitamin D-rich foods lower those markers. For men, this can cut colon cancer risk by nearly half. Not all inflammation is obvious. Watch for these for hidden inflammations. They're most closely linked to cancer. First, chronic gastritis. Symptoms include bloating, heartburn, or persistent indigestion. 40% of people over 35 have chronic gastritis, and it increases stomach cancer risk by 5 times. Second, gum disease. Bleeding gums aren't normal. Severe periodontitis increases the risk of oral cancer by 2.7 times. Third, hepatitis. Feeling fatigued or having yellowish skin. 86 million people have chronic hepatitis B, and their liver cancer risk increases by 20 times. Fourth, lung inflammation, like a cough that won't stop. Chronic bronchitis increases lung cancer risk by 3 times. If you have any of these symptoms, don't delay. Early intervention can stop inflammation before it turns into cancer. You don't need fancy medication, just 3 daily habits for protection. First, test your inflammation levels. Ask your doctor for a C-reactive protein CRP blood test. Even normally high levels, 1 to 3 milligrams per liter, increase health risks. Second, swap one food every day. Replace chips with nuts and sugary drinks with green tea. Small swaps lower inflammation fast. Third, fix small issues. Address gum disease. Get tested for Helicobacter pylori, the bacteria that causes gastritis, and quit smoking. The invisible driver doesn't have to win. Your next meal, your next doctor's visit, they could stop cancer before it starts. What's your biggest inflammation-related habit? Share in the comments below. Let's tackle this together.